Discussing about muscarinic antagonists. Atropine occurs in deadly nightshade, Atropa belladonna. It is a weak central stimulant, especially on the vagal nucleus, and low doses often cause bradycardia. Higher doses cause tachycardia. Hyoscine is more sedative than atropine and often produces drowsiness and amnesia. Toxic doses of both drugs cause excitement, agitation, hallucination, and coma. The student should understand why these drugs produce dilated pupils, blurred vision, dry mouth, constipation, and difficulty with micturition. The latter effect, although usually unwanted, is useful in patients with overactive bladder associated with urinary incontinence. Antimuscarinic drugs, for example sulfonacine, darifenacine, reduce detrusor muscle overactivity, probably by an action on M3 receptors. So that was all about the autonomic drugs acting at cholinergic synapses. Stay tuned to sqadia.com for more.